The profession we were given is mental health and substance abuse social workers. And these social workers assess and treat individuals with mental, emotional, and substance abuse issues, including the abuse of alcohol, tobacco, and/or drugs. Their job revolves around diagnosing clinical disorders, identifying client goals, formulating a plan to meet those goals, connecting clients with resources to supplement, and working with clients to achieve the goals set out in their individual plans. Their duties may also include conducting group and individual therapy, crisis intervention, case management, client advocacy, prevention, and education. Since mental health and substance abuse social workers are able to work in a variety of different places, such as hospitals, courts, correctional facilities, employment assistance programs, private practice, detention centers, psychiatric hospitals, mental health clinics, government agencies, and substance abuse recovery facilities, they'll just report to whoever is high up, such as management. They'll interact with people who have mental and substance abuse issues, their clients' counselors, and their clients' physicians. Once someone gets a bachelor's degree in social work, they can specialize in whatever field of social work they're wanting to do. But since you specialize in a certain field, it's kind of hard to go back and forth. So if you start out as a mental health and substance abuse social worker, you can't just automatically go to be a school social worker. You'll have to specialize in that. But if someone is wanting to find another area, they could choose marriage and family therapists, rehab counselors, healthcare social workers, family and children social workers, school social workers, or probation officers and correctional treatment specialists.
For demand, employment for mental health and substance abuse social workers is projected to grow 18% over the next 10 years, which is much faster than the average of all occupations. Employment will grow as more people seek treatment in mental illnesses and substance abuse. Drug offenders are increasingly being sent to treatment programs, which is staffed by social workers rather than sending them to jail. Overall employment of social workers is projected to grow 15% over the next 10 years. Job prospects are very good and mainly for clinical social workers. The continuing growth for healthcare spending and treatment increases the opportunity for social workers who offer treatment services. The demand for social workers are increasing because more and more people are needing treatment programs.
Social workers can add value in nonprofits, private industry, and in corporations. They use their connections, and that's how corporations engage with the community and find the strategic intersect where the corporation is trying to develop great relationships with their employees.
To successfully become a mental health and substance abuse social worker, someone will need to get their bachelor's of social work, and if someone has had experience in a practicum or internship setting, they'll more likely get hired than someone who hasn't. Once someone gets their bachelor's in social work, they can either start working at an entry-level job, or they could go back to school to get their master's. And having your master's could move you up the career ladder, and you could get a higher paying salary, and you could advance to management. The licensure criteria for mental health and substance abuse social workers outside of private practice vary from state to state. For example, not all states require applicants to have a specific degree, but may require them to pass an exam. And since social workers work very close with people and their problems, they need to make sure they have certain characteristics such as the concern for others, they're dependable, being compassionate and empathetic, having good listening skills, patience, good speaking skills, and having good ethics.
Mental health and substance abuse social workers currently have the highest predicted growth increase of any profession. The demand for addiction counselors is expected to increase by 15% by 2025. The average median salary for social workers is $14,000. As coverage expands for addiction treatment, the average salary is predicted to grow. The opiate epidemic has created a high demand for substance abuse counselors. Demand is also increasing due to the Affordable Care Act mandate to cover mental health services.